Breast reduction surgery in India is becoming an increasingly frequent request from our patients. But however, there's a lot of ignorance, there's a lot of lack of awareness in this particular field, and because of this, there are so many questions to be answered for our patients. And the common question asked by our patients is whether this can be treated by medicines. Certainly not. The reason for this is lifestyle problems like they're obese. Obviously, the breast is also going to enlarge. But the other common problem is genetic variation, where there are predisposed to having enlarged breast. So either case, they will have to seek surgery because this presents with a lot of symptoms. Most of the patients who reach to our clinics, they come with symptoms. They're referred to us not just directly from patients walk into our clinics, but sometimes they're referred by orthopedic surgeons because the patient has neck pain, or some patients may suffer from low backache. They have a lot of fungal infections in the breast creases. Some patients, because of the heaviness, they have brass straps cutting through. Body image problems with these patients. They feel very underconfident, and and as a result of this, very low self-esteem, and so they don't go out into the society, and even if they want to do gymming, it's very difficult because it's unnecessarily attracting a lot of attention. So these are the problems which they face, and finally they come to the plastic surgeon. And of course, the plastic surgeon, once they see the heaviness of the breast, can immediately say that okay, the problems can be attributed to the uh, enlarged size of the breast, and therefore a surgery is necessary for these patients. So medicines as such is not going to help in any ways, and that's just a myth that most of the patients have, that medicines can do something. So it's purely a surgical problem, and once corrected, most of our patients are very happy. Usually the breast surgery, what happens is we plastic surgeons, we remove a portion of the skin, we remove a considerable size of the gland, and along with it also the fat. So if the breast is very dense, like having a lot of gland, that means the surgery itself is the end thing. You don't require any more surgeries, and the recurrence is almost practically less. But however, if the fat content is more, which means it's more probably related to the lifestyle, and there is a chance that the patient can put on weight if they have erratic lifestyle habits. So by and large, most of the patients, they undergo a breast reduction surgery, a lot of gland is removed, a lot of skin fat is removed, so the chances of recurrence is practically very minimal. A lot of patients ask us when they seek breast reduction surgeries, they have this myth that breastfeeding may not be possible because we plastic surgeons are cutting away the tissues. This is not true. So when we do a breast reduction surgery, it's very properly organized, and a considerable portion of the lactiferous ducts within the breast is preserved, and it's only the 70% of the breast tissue which is removed, and the 30% which is left is enough for patients to breastfeed. And we've had significant amount of patients in our practices that patients call up during their lactation period, and they tell us that they have successfully breastfed their children. So breastfeeding is usually not a problem in breast reductions. And the other technical thing is when we remove the portion of the gland, we preserve 4 centimeters of tissue under the nipple areola, which enables the patients to breastfeed. Sensory loss after breast reduction. Again, another very common question asked by our patients. Breast is an extremely sensitive organ, and people ask us these questions, what happens because there's a cutting involved. So as plastic surgeons, what we do is we have a technique where we preserve all the tissues on the muscle fascia, and this is where all the nerves enter the breast. And because of this preservation of this structure, the muscle fascia, and we don't really encounter the nerves at this particular level, and safely we can say all our patients that the sensations of course will take some time to come, but they'll definitely come back, and they do have protective sensations and even the other sensations which are associated with the breast. When breast tissue was when it first came up, and it was evolving, there was a lot of scarring. So this particular scar is called the anchor scar, where it's almost like a T. So you have the vertical limb and then you have the complete horizontal limb. And in Indian patients, scarring becomes an issue. Not so much in Western patients who are very light colored, but in Indian patients, especially when you have scars in the lower part, especially in the lower central part of the chest, they show up. And as plastic surgeons, we know that we need to avoid these scars. So what we do is we do what's called as a short scar or minimal incision breast reduction, where the scar is in the center, is vertical like this, and it goes into the breast crease, which is not actually visible, and this part is practically not visible. It's only what you see is a vertical line which is around inch in length. So you can say that scarring is not an issue, and just because of the design what we give our patients, and even if those patients begin to form scars, we have scar modulation creams, and we also consider the fractional CO2 lasers in such patients, enabling the scars to even fade further. So once you see these patients after the scar modulation creams and after the lasers, practically if you see them after maybe around a year or so, they turn out very fine, and most patients are pretty happy with the scars that we give. Breast reduction surgery, if you look at the literature, the amount of articles which have been written, the complication rates can be up to the tune of 35 to 40%, and this is quite high. So when we talk about complications, we're talking about the problems that patients suffer after a breast reduction, and usually these are because of the wound healing problems. So this is a major problem in giant breast reductions. Invariably, some patient or another will have these complications, and they have wound which has dehisced, wound which has broken down, and it's oozing some amount of fluid because of delayed healing, or so on and so forth. There are a lot of problems, and there could be even seromas and hematomas associated with these problems. So what we have done in our patients is we have tried to reduce the incidence of complications. So in our series of patients, we have done something different, where we do breast reductions differently. So especially when we are trying to prevent wound healing complications, we use something called as a VAC assisted closure, which helps in earlier wound healing, better scarring, and much finer scar when it happens when we don't use the VAC in our patients. So vacuum assisted closure is something which I do routinely for all my giant breast reductions, and the healing rates are much better. The other common problem which can be faced by plastic surgeons when they're doing breast reductions, and we are doing differently, is the nipple areolar complex. The crux of the matter of breast reduction is the nipple areolar complex, and we don't want the nipple areolar complex actually anything going wrong with it, or it suffering because of blood supply. So whenever there's a giant breast, we do what is called as a delay procedure, which helps in preserving the blood supply to the nipple areolar complex, and thereby preserving the entire cosmesis and preventing any further complications. So this is what we do differently in our patients. The other thing what we have done in our series of patients is, initially the results are very good, but long time what happens is the lower pole tends to bottom out. So because of this bottoming out, what happens is the shape and all is distorted, and the patients don't like this face. So we have done what is called as the dermafacial flap, which helps in giving the support and preserves the naturality of the breast even after a few years after surgery. So these are the things which we have probably done differently, and where we achieve much better superior aesthetic results. When we are actually talking to our patients in the consultation room, the probably one of the few questions asked by the patients is, how much will I come down when you do the surgery? So we have a method of calculating the cup size. I tell my patients that if we remove 300 grams of tissue in the from the breast, the cup size comes down by 1 cup. So if you're removing probably 600 grams or 900 grams, the cup size comes down by almost 3 cups. So that's the estimation. So every 300 grams, the cup size comes down by uh, by 1. And you must know that the breast reductions are in three categories: the small breast reductions, the medial breast reductions, and the large breast reductions. The large breast reductions are something where you remove more than 1000 grams of fat. So here obviously the cup size is going to come down significantly. The medium size reductions are those which are 500 grams to 1000 grams. So these are something where the reduction is not too much. And the minor breast reductions are only removing up to 500 grams of tissue, where you can achieve only 1.5 cups maximum. All our patients after undergoing the breast reduction are given a surgical bra. This is meant for support, and also helps in better shaping of the breast. Also prevents the formation of seromas and the hematomas. The patients are given non-absorbable sutures, so there's no suture removal, and usually the dressings are done every once in 2-3 days. The patient is made to shower on the fifth or sixth day, and the surgical bra is made to be worn by the patient for almost 3 weeks to 4 weeks, depending on the size of the breast. And usually from day 10 we start doing the massages, and this helps in reducing the swelling in the breast, and helping the patient to shape back faster. And scar modulating creams are given maybe after 2 weeks, once the entire suture lines are dry, and this helps in modulating the scars and preventing the scars from developing a prominence or even a scar hypertrophy, and this helps in better formation of scars.